Today we shall be dealing with hemoptysis. It is the expectoration of the blood from the respiratory tract. How does the blood come? Because the lung has got dual blood supply, one from the pulmonary artery and the other one is the bronchial artery. The bronchial artery is going to originate from the aorta and supplies the main airway, while the pulmonary artery is a low pressure system and is just responsible for the gas exchange at the alveoli level. First step in a patient of hemoptysis is to ascertain whether the bleeding is coming from the nose or from the GI tract. That is, it may be either epistaxis or hematemesis. When it is coming from the lung, the most common site from where it is originating is the bronchi or the medium-sized airways. How to approach a patient of hemoptysis? When a patient comes to us, we take the history and physical examination, where first of all we have ruled out the causes of bleeding from nose or GI tract. When the bleeding is coming from lung, we have to see whether it is massive or non-massive. Bleeding is called as massive when it is 400 ml in the last 24 hours or 150 ml at one single time. When the condition is non-massive and there are no risk factors in an individual, we treat the specific condition. While the risk factors are present when we took all the labs, imaging methodologies, and then control the bleeding. And for the condition where the bleeding is massive, we need to protect the airway first, stop the bleeding, but if the further bleeding continues, embolization or resection is used. So accordingly, etiologies, it could be infectious. The conditions included are viral bronchitis, where the person will have a blood-tinged sputum and small amount of hemoptysis. Condition called as bronchiectasis, it is the leading cause of massive hemoptysis, and bronchuria, massive production of sputum. Third one is tuberculosis. Earlier used to be the most common cause, but now it has been replaced by bronchiectasis. In tuberculosis, the cause of hemoptysis may be due to the complication of Rasmussen aneurysm or due to the cavitary disease. Other infectious agent may be Aspergillus, Paragonmias, Nocardia, and other non-tuberculous. Other vascular causes, which includes pulmonary edema, which are ideally characterized by pink frothy sputum, but the individual may have frank blood. Second one is pulmonary embolism with parenchymal infarction, where the bleeding may occur due to an ectatic vessel or some arteriovenous malformation. There may be some rupture of aortobronchial fistula or diffuse alveolar hemorrhage. Causes in malignancies include bronchogenic carcinoma, which can cause both massive and non-massive hemoptysis. Other small and squamous cell carcinoma of lung. There may be pulmonary metastasis either from melanoma, sarcoma, or adenocarcinoma of breast and colon. Conditions of Kaposi sarcoma and a retroviral individual can also have. The other causes are pulmonary endometriosis, where the regular shedding of the blood is known as catamenial hemoptysis. There may be foreign body aspiration, diagnostic and therapeutic procedures performed in an individual, or the person having treatment for anticoagulants or antiplatelet therapies. The important history in an individual which are suggestive of features of hemoptysis, like when a patient is having fever, chills, or antecedent cough, they could be suggestive of some infectious pathology. While in an old age individual with history of smoking and weight loss, there may be findings of malignancy. Or when there is some occupational exposures, interstitial lung diseases may be noted. On physical examination of a patient, first we have to examine the vitals. Second is the examination of the nasal and the oral cavities. If even clubbing is noted, it may be suggestive of lung cancer or cystic fibrosis. How to diagnose the condition? First, we have to send all the routine lab investigations. In an X-ray, we can find out whether what could be the etiology of hemoptysis. If it is a normal X-ray associated with no risk factors for malignancy, we could treat the condition as bronchitis. While if the risk factor for malignancies are there, we need to plan a CT chest, which could be followed by flexible bronchoscopy. What interventions could be done in an individual are, first of all, chest X-ray. Any new opacity noted could suggest the presence of site of bleeding. CT angiography for localizing the active site. Flexible bronchoscopy. Still the bleeding is not controlled. Bronchial artery embolization is the treatment. And finally, if the disease is localized, surgical resection could be carried out. Thank you.